Georgia Congressman Doug Collins is one of several Republicans who have decided to self-quarantine after coming into contact with an infected person at CPAC.
Joining us now live from his home is our headliner this morning, ranking member of the House Judiciary Committee and Senate candidate Doug Collins. I appreciate your time this morning. I appreciate you Skyping in, considering you are staying in. Why did you decide to do that?
We did so out of abundance of caution. It's good to see you, though, and because we came in contact. It's been 2 weeks ago today. In fact, today is my last day. I'll be back out tomorrow. I'm asymptomatic. I don't have any. I've never had any symptoms of the virus. But what we wanted to do was make sure that, out of abundance of caution, stay in and emphasize to everyone that if they follow the rules, they follow the protocols that are set out, that we can manage this virus and we can do what is right. And I think by doing this, we're setting an example to say others, don't take it lightly, take it seriously, but also don't panic. Make sure you're doing the right things, washing your hands, staying away if you're sick. And if you are sick, go to the doctor and get tested. Yeah,
very important advice, and we're certainly concerned about your health and the health of all lawmakers, staff, everyone around the country, obviously. But this is also happening in a context where in the last moment, we've just gotten a new statement from Senator Ted Cruz. He's also been self-quarantined, as you know. I believe in Texas, he's now saying that his D.C. office is going to close temporarily. Senator Romney has done the same. There's at least one case of somebody who's tested positive for coronavirus in the office of Democratic Senator Maria Cantwell. So it's happening in that context, Congressman, while Wall Street is also suffering a very volatile day right now. And a lot of people around the country are looking to you and other lawmakers to get the nation's business done and working on an economic proposal that the president wants. How do you balance all that, sir?
Well, it's been a large balance, and I think I've been at work all week down here. We've had other bills on the floor this week, FISA bills, and also now working. I was just on a conference call with my colleagues concerning our response. Look, I think you'll see a lot of other offices, especially next week. We're not supposed to be in next week. You'll see probably a lot of staffs working from home. Probably we're discussing that right now in my own office and making sure that our D.C. office, because you will see it. We're already starting to see it. A couple of cases, it looks like now on staffs on the Senate side and others. So it is a very real concern, and we want to stop it in its tracks. This is why the protocols are in place, is so that we can identify those that are sick, isolate them, get them better, and so that others aren't infected. But in dealing with also this economic side, the president made it very clear last night that he is willing to help, but he wants to help in the proper ways. Simply throwing money at the situation right now without having the proper oversight. Even Democrats last night in the Rules Committee were very concerned about the fact that no hearings or anything were involved in this. We want to work bipartisanly together to make sure the American people have what they need from an economic standpoint, but it needs to be targeted to make sure that the economic stimulus or the economic progress here is not simply just throwing money at a problem without any real solutions to making the economy or helping those who need help.
Well, you can assume the market's looking for a solution because as you've been speaking, the Dow's been off more than 2,000 points, and we can now report that the Dow has fallen to its lowest level since July 2017. So looking at multi-year lows here, and I'll let you know that our reporting from Capitol Hill as of this moment is that GOP leaders McCarthy and McConnell oppose House Democrats' coronavirus bill. The status of the bill is now in limbo. Congressman, how do you respond?
I respond in unison with our leader McCarthy in this as well, and Mr. McConnell. Again, we need a stimulus package, but we also need something that actually will work. There's nothing that we've seen so far that actually stems this tide. Simply putting money into unemployment insurance when you have unemployment claims at their lowest. These are things that you work on as the situation develops. We need a stimulus now that, if it works, help small businesses, make sure that you get extended leave. Those are the kind of things that could work into this bill. But right now, we've not been able to partner on this like we did with the coronavirus package from last week, in which we provided funds for the actual attacking of the virus and the response to that virus. That was bipartisan, over 400 votes. There's no reason why we can't do this today and work on that as we go forward. And I know our leader, McCarthy, and others has talked to us, and Kevin Brady and others talked to us on the conference call about why this is not a package that at this point we can support. But I know the president is committed to finding something that is possibly going to work, and our leadership is committed to working with the Democratic leadership to find that. Markets would be aware of that, and I think we just need to make sure that we have a focused response, and I believe that's what the administration is giving.
Congressman, in fact, you just mentioned the House Republican leader, Kevin McCarthy. We expect him to hold a news conference live in the next few moments. We, of course, will go there live to hear what he's saying about these economic plans, about the health response as well. well. Of course, Speaker Nancy Pelosi expected to have a news conference later in the hour. We'll go there as well to hear from both sides. You're laying out the important economic response and what you want to see happen. What about the health response? About a week ago, you were with the president in your home state there in Georgia at the CDC headquarters, and we've been hearing from the administration that they're prepared on testing, and that if you want to be tested, you can be tested for the coronavirus. But a few moments ago, Sandra interviewed Republican Senator John Barrasso, who, as you know, is not just a senator, he's a doctor, and he said he still has concerns that the CDC can really follow through on that. What assurances can you give the American people this morning?
Well, I think the assurances that I have straight from the CDC and working with and listening to not the president, but the vice president, the task force, and watching this closely. The CDC is, of course, in my home state. We never forget, this is the group that also just a few years ago was able to get under control the Ebola virus and others. These are not people who are unaccustomed to dealing with hard issues, and they're dealing with it. And I think the issue that we have now is we need to make sure testing is there for those that are sick. What we don't need to have is rushing our healthcare system and rushing our public health system with folks who are just wondering if they have the virus. If you're sick, you have conditions, flu-like conditions, symptoms, then go get tested. But I think right now, the testing, as it's ramping up, the more test kits are available, we'll be able to make sure that anyone who has those symptoms are being able to be tested. I trust the CDC. It's always, as we look forward to, we make sure that it is happening in real time. They're putting forward the results. I think we'll see over time as that works out. But right now, I have every confidence that the public health officials all across this country, in every state, are doing everything they possibly can to make sure that they identify the proper cases, make sure that they're properly quarantined, make sure they're properly being treated, therapeutics are being developed, and a long-term vaccine is being looked at as well. The big thing for people is to not panic in this, but also to make sure that they're doing what is responsible. And one of the biggest things, and I've told people this for the whole week that I've been here, is some of the simplest things are things that sometimes you forget when you believe it's a big crisis. This goes back to simple, basic personal hygiene. Go back to the sink, use soap, wash your hands. Don't go out and cough on people. If you're sick, stay away. Yep. And if you're if you are sick, make sure that you're treated. Those are the ways that we can make sure that we isolate this, stop it. It will continue to grow, but we can do so at a much lower pace than we've seen in the rest of the world.
We're learning a lot more about the spread of it and how long it can live in the air, things we didn't even know yesterday or a week ago. So, Congressman, there's still a lot to take in. As you can see, markets taking all of this in this morning. We wish you well as you finish off your self-quarantine there. And Ted Cruz, I think, finishes his this afternoon while he's also shutting down his office now. We appreciate it, Congressman. Thank you for coming on.
Thank you, sir.